I'm Dr. Rick Greene from the medical school class of 1970, and it's my pleasure to be the host of a series which brings in our wonderful faculty from UVA and just talks to them about their thoughts about being faculty and about being in Charlottesville and many other things. And it's my true pleasure to be talking today to Dr. Sharon Hostler, the Birdsong Professor of Pediatrics, prior Dean, and a wonderful faculty member at UVA. So Sharon, welcome.
Thank you. It's an honor to be here.
I know we overlapped a little. I was a student, left in 1970, and you were beginning your career. But I want to go back to Vermont, because you're a native of Vermont. You went to Middlebury College. I know something about Middlebury College. How did you get to Charlottesville? How did you get to UVA?
It was true love, and probably not the right decision in many ways professionally at that point.
Really?
Yeah. I was a barmaid at Woods Hole in the summer times during medical school. Woods Hole Oceanographic Institute is right there, and I'd met the love of my life, Alan Dimmick, there. And so going to Boston seemed to be the right thing to do from Boston Children's as I left for my fourth year of medical school to San Juan, where I spent the year as an acting intern at the Children's Hospital in Rio Cuevas. But in that year, my husband-to-be moved to Washington, D.C. And so Jerry Lucy, my neonatal mentor at Vermont, and Bill Thurman, his good friend who had just come here as chair, made the arrangements that I would end up in Charlottesville. So I came back and came here essentially sight unseen.
And you stayed here the entire time?
I sure
You
did,
haven't
even
left.
though I intended always, I was always going to leave.
Yeah.
This was just a pass-through until I fell in love with the University of Virginia.
What was it that caused you to fall in love?
Oh, it took a while. I think that my husband was killed when I was 34, and I had kids, and I had his kids from a previous marriage, and so it wasn't a good time until I got tenure to leave and go back to New England, which would have been my intent. And so I weathered that piece, and then soon learned to love what I was doing and loved the opportunities, early opportunities for leadership I had from Dr. Thurman, who was the chair, who continues to be, one of those men that I'm amazed that he had the faith in me and offered me the opportunities very, very early on in my career. And so pretty soon I was, having a really good time here. And then when the opportunities came to be chair, I was then remarried, and that husband who'd come, Joe Boardman from Manhattan, was not at all interested in going to Albuquerque or Rochester. He'd come to Charlottesville, and that was quite enough. And I think when I really, when I was given the Macklemore Birdsong Chair was the moment. I think that was 1989 or 90. And we'd had done a commission looking at the status of women at the University of Virginia School of Medicine, which became a model for 55 other medical schools to look at fairness and culture. And I'm sure because of that, I would receive the Birdsong Chair. And, my colleagues said, oh, Mac would be rolling over in his grave to know that this woman had his chair. I said, oh, he's rolling over in his grave because it's a Yankee in his chair. So I think it was from then on that I was clearly here and I wasn't leaving, and had such wonderful opportunities to look at promotion and tenure and to essentially rewrite so that the biological clock and the tenure clock was fair for men and women, and the cycles made sense. It took a long time for me to understand that tenure rules were made by white men, who had wives at home and staff in the office. And, there was nothing magical. It hadn't been God-given. I mean, we could actually address that. And we did that with a group of chairs in the early 90s, and it was really heady work. It was wonderful to have, every week this task force with all the basic science chairs and the clinical chairs met. And, that's the fun of this place, is being able to be across all the school and to be across the entire university. I mean, early on, I've always liked to write. I love literature, and I taught in sociology. I taught across grounds. I attended classes. So the opportunities to be, part of medical humanities with Marcia, Childress, and to be part of the writing projects with Danny Becker. It's been fantastic.
What was your major in college?
Well, I was a chemistry major, but I really did everything I needed to do for an English literature.
I figured.
And I was not allowed to be a pre-med at Middlebury. Professor Hitchcock, about whom I'm writing at the moment, was chair of biology, and there would be no women as pre-meds. And so I did chemistry. And my chair of chemistry, E. Kirk Roberts, said, you have a scientist. We have a scientist going to medical school. We don't have one of those. We're not teaching chemistry and physics for physicians, like poets. You've done the real deal. So I did. And I'm glad I did.
Let me ask about pediatrics, because I'm always fascinated in this series to find out why people gravitated to the specialty they did. So what was it about peds early on that pulled you in?
Well, I was clearly not going to be a baby doctor. I mean, that's what everyone said. First of all, they said, you're taking the place of a man to go to medical school. You don't have the money to go. You don't have the money to go to college. What do this is craziness. And so I was pretty clear I wasn't going to be a psychiatrist or a baby doctor until my third year up at the University of Vermont. And one of Jerry Lucy, another fabulous mentor and the editor of the Pediatrics journal for many, many years, until recently, he's still alive. He insisted that when on our rotation we had lots of things we had to do. One of them was a 2 a.m. feeding up on the ward. And that was the night that I just fell in love with the kids and with the whole process of being in hospital and all the demands. And I ended up spending the rest of the night helping the nurses and talking to parents, and that's when I was. And Jerry also had an external examiner, someone from Boston, a big city, came. And it was an outsider, and they took your notebook of all your patients, and so you were examined on your patients, and that was a wonderful experience. And so then Jerry said to me, you're not going into internal medicine. I want to send you. Where do you want to go? Anywhere in the world and do pediatrics. Well, Caribbean looked pretty good from this kid from Vermont, so I did. And San Juan.
So obviously you gravitated to academics, but what was it about the academic life versus private practice in peds? I mean, did you ever consider that?
Oh, I think after the third infected year, I would probably. Well, here we were small. I mean, you could go into the lab. I mean, Bill Thurman, when my first 4-year-old, as an intern, came in with a few petechiae and kind of pale. And we looked, and we ended up doing the bone marrow. We went and we looked at the cells in the microscope together. We went and pulled the envelope, in the clinical trial, and talked to the parents that night. We did the whole piece. We got the first dose and admitted. I mean, it was that business that here we were so small you could be all part of it. Now, I did have a fetal rat. No, that's wrong. I had I had a fetal rabbit laboratory. And I had to sacrifice the fetuses. And I certainly did not like being alone in the lab, counting reticulocytes and doing those processes. And the mothers would thump when I would me. I think, what kind of a person am I that I'm causing terror in these rabbit mothers? This is not good. So I was lucky. I had, it was fortuitous about not staying in the lab as a hematologist with Bill Thurman, but the guy who was the medical director of the Children Youth Project, which is a war and poverty project here, had a heart attack. And so Bill said, Sharon, guess what? He did that again too for the Children's Rehab Center. Sharon, guess what?
Yeah, serendipity plays a role.
Yeah, and so I zigzagged, and I'm really glad I did because I had a good time.
You mentioned mentors that were important to you. What makes you a good mentor? What do you think has made you a good mentor over these years?
I really like them. I care about them, not just for what they're doing that's going to make my career or my profession or whatever I'm doing more wonderful. I really want them to be at one with themselves and at one with the world, and be contributors and understand the joy and the beauty of taking care of kids and whatever it is they're doing. And I'm still, as I was just saying, I trained 17 developmental pediatricians in fellowship out at Kluge Children's Rehabilitation Center. And this year I'm going to visit all of them, and I'm having a grand time, because obviously we know them well, and I know the children and I know the families, and so it's been a wonderful experience to see them, all over the country and in academics, and responsible for usually their state or their region for all the services for kids with special needs. So it's been great.
I know you like to write. You've told me that. I know you like to play bubbles with your grandchildren. What else do you like to do? What gets you up in the morning?
Well, I love to read, and until recently I've loved to play tennis, second knee, and I love to travel. And so semester at sea for me was an incredible opportunity. When it was announced that the University of Virginia was getting that program, semester at sea, in 2007, I immediately wrote to President Castine and said, I want to be the academic dean, and he wrote back and said, arts and sciences, Sharon. I said, oh, you don't know, I can do arts and sciences. And so in 2011, I went in the Caribbean with some engineering students, and I loved every part of it, the research meeting at the end of the day. And so then I applied, and I pestered and pestered and pestered. And so in 2013, I got to go around the world traveling west with 720 undergraduate students from 200 some different schools. And I got to do those things that I've always loved to do, which is about leading and about bringing a wonderful faculty together, again, from all over the world. And that was great. And those friendships have continued. I went again in 2015, where we did the Atlantic exploration. And so right now, when somebody says, you want to come to Australia? Yes. Do you want to come to Alaska? Yes. I'm going. And
So
I'm learning
traveling
to,
is an issue.
traveling for me.
Traveling's fun.
When we're, well, I don't know about surgeons, but pediatricians and mothers
Yes.
often, didn't get to go as often as I would have loved to. And so right now, I'm 77, and I intend to keep traveling as long as I can, understanding that I may not always be able to trek after the silverbacks, which we're doing in July with 10 of my family.
Marvelous.
So we're having a good time.
Well, I know I speak for the entire Alumni Association when I say having you as a faculty member here has been very special. And I appreciate the fact that you're willing to share some of the things with us in this program. And it's been our pleasure to talk with Dr. Sharon Hostler today, the Birdsong Professor of Pediatrics, former dean, writer, traveler. Thank you so much for being here.
Thank you. It's my pleasure.
Appreciate it.